Hi! So in between the two operatories, we have our X-ray unit. So if you didn't notice, there's these, we have these, so they're shared. So in between, the X-ray unit is shared between two operatories. It's a cost-cutting measure. So this tube head can go to this operatory and be used, or it can be pulled to this unit and be used over here. Okay, here's the control panel. It has the arm. It has the yoke, and the yoke will turn around. The yoke is what you can hold it with. This is called the tube head, and it also rotates. Okay. If you think of it as a gun, this part that points, this would point toward the patient's face. This is called PID, Position Indicator Device. So PID, also short for Position Indicating Device. This is the part that you're going to actually point toward the patient. And that's where the x-rays are going to be taken. We have some barriers here. These get put on here when you're actually taking on real patients. We put these on, it's like a bag. And we put these on here to keep it clean and to keep the saliva as much as possible away from the tube head. Now if you look here, this is the exposure switch. Okay. If I were to push this button with this being on, I would get x-rays coming out of here, so I'm not going to push this. Now also you need to look for the on and off switch. Sometimes you can't see it, but you could feel it. So it's right there. And this one was already on, so you should always turn it off before you're done for the day. So now it's on. The way you can tell it's on is if the light is on. So now it's on. So you should always be off at the end of the day. This one was left on, so that's not what we want. So I'm going to turn it off. And if I push the button, nothing happens. It only will expose once it's on. This is a sensor. This is what's going to be put inside the patient's mouth with a barrier. It's going to have a different kind of barrier on it. Another little small baggie. And this is what gets put in the patient's mouth to take the x-ray. This gets hooked up to the computer, which we're not going to do today in this video. But this gets, it's got a USB, so it gets hooked up into the computer, and this is what actually captures. It's got pixels in there, just like your Pixel camera, and when this gets exposed to the PID with a tooth in between, that's how you get your image. So that if my finger was a tooth, it would get an image, or even if I did my finger, it would get an image of my finger. It would get an x-ray of my finger.
Telangioma.
These are very expensive, so we'll show you how to care for these because they're very, very expensive and we don't want to drop them either. So let's look at the settings. Okay, so this is the unit. This is just the control panel. It also has an exposure switch here, but again, you don't want to press that, especially when the unit's on, because it will give x-rays to whoever's in front of the PID. It has different settings, and we'll have you fiddle around with these. It's really hard to see, but it has upper anterior, lower anterior, so it has wherever the light is. Then it has, you don't know your teeth yet very well, but that's upper premolar, lower premolar, It also has for adult and a child, so right now it's set up for an adult. Upper molar, lower molar, and it changes the settings every time you change what you're taking up. This is for an occlusal, which you don't know about yet, but you will before the semester's over. That's for endo. That's for bite wing. If you've gone to the dentist and they take just 4 little x-rays every 6 months, that's the bite wings. And then you could change it to child. So we only use the amount of radiation that's necessary, so that's why the changes of the settings. Okay. Some of the other machines have, have the settings on the, so instead of being on the wall, they have the settings on the control panel, on the exposure switch. It's really nice. So one thing you have to remember, in order for you as a person taking the x-rays, you have to be 6 feet away from where the x-rays are being taken. So if this is being taken, you can come on over here. So if there was someone sitting here and we were taking x-rays here, when I go to push the button, I need to be 6 feet away and I can push the button safely. That's the only time you should push the exposure switch, is when you are 6 feet away. And if you look at the squares, they're 2 feet each square. So 3 squares away, you are safe. 6 feet away, and make sure no one else is around. No one else is within the 6 feet except the patient. Did you look at the x-rays? So you're going to be taking these x-rays. This is not quite a complete set, but they come out on the computer once we do take them. So you'll be doing this in a few weeks. You'll be doing so good. You'll be surprised how much you'll learn in a few weeks in radiography. Thank you so much. Looking forward.